Hello, my name's Miranda Marlin, and my current healthcare topic that I've chosen to do is access to healthcare in rural hospitals. I tried doing this presentation several different ways, and I didn't really feel like I could do this topic justice without speaking to the current healthcare crisis that is affecting rural hospitals. Currently, there have been 83 rural hospitals that have closed between January 2010 to January 2018. There are currently 673 rural hospitals that are at risk for closure, in addition to those 83 that have already closed. That is 1/3 of the rural hospitals. These closures are creating what is called medical deserts that are occurring all across rural America. Medical deserts are when there's health care that is limited or non existent in areas. Currently, 77% of rural counties are primary care health professional shortage areas, with 9% having no physicians at all. 60% of all trauma death occurs in rural communities, and that is an outstanding number considering only 20% of the US population are rural residents. On the positive side, it is 2.5 less expensive to provide identical Medicare services in a rural setting versus an urban setting. However, Medicare reimburses less in a rural setting than it does in an urban setting for the identical services. If all of these vulnerable hospitals that I talked about, those 673 closed, there would be 99,000 healthcare jobs lost in rural communities and across the nation, with an estimated $277 billion loss to the gross domestic product. That's huge. There would be no way to compensate for that. So, why are all of these hospitals closing? Well, there's decreasing patient volumes. You have to think of all of the baby boomers that are retiring, and I, as someone that lives in a rural community, I am thinking of in the last 3 months, how many of our patients have we lost, and how many people have given birth. We have had probably 6 to 10 people die, and we have maybe had 2 births. So that is a very unbalanced population swing. So communities really need to look why there are specific populations decreasing. Um, is it the overall population decreasing, or are they losing competition to larger facilities? Um, there is significant capital expenditures. You have to stay competitive. Small hospitals are competing against other small hospitals. My rural facility that I work at, within 45 minutes north, south, east, and west, there is another rural hospital. Granted, uh, the trauma centers are 3.5 hours away. We have patients that are willing to drive back that 3.5 hours to go to their follow-up appointments. If they know that they're going to be sent there anyways, they might defer from our emergency room and drive there if they're stable patients. So there's a lot of competition for the small facilities against the larger facilities. Plus, there's a lot of federal regulations that hospitals are required to stay compliant with, and those aren't cheap. Just think about your electronic medical record systems that you're required to have. They don't cost $100 to have one of those. Those are thousands to millions of dollars depending upon the size of your facility. And everyone must maintain those. Understanding the cost of healthcare. Hospitals need to look at the cost of each component of patient care in order to negotiate insurance. If you don't understand how much a clinic visit is versus a treatment room visit versus your inpatient versus your ER and each level of care, you can't effectively negotiate your insurance premiums and prices. And for a small facility, you don't have enough staff to dedicate to doing that. High levels of bad debt. They've made some changes with the federal government, the way they reimburse for bad debt, as well as the Affordable Health Care Act, and people being able to get insurance. So this is creating higher deductibles, increased ER visits for non-emergent health care needs. So the small facilities cannot absorb those high levels of bad debt. So I'm going to look at the facility where I work, Dundee County Hospital. We have a clinic, so this slide talks about the Quality Healthcare Clinic. Our hospital is county governed and a non-profit hospital. It was constructed in 1968 as a 30-bed facility. It is now designated as a critical access hospital, which was done in 2000 and was decreased to a 14-bed facility. We're currently in the process of undergoing construction, hopefully to begin in the next 6 months, and we will decrease the number of beds from 14 down to 8. And not all of those beds will be inpatient beds. Some of those beds will be just 24-hour outpatient beds. We employ 4 full-time providers. We have nursing staff, physical therapy, lab, radiology, speech, respiratory therapy. We have a 24-hour emergency room services with basic trauma certification. We have clinic services with a secondary location offsite. We have contracted services of 12 specialty providers that come in at various times throughout the month. We have MRI, ultrasound, echo, occupational therapy, and nuclear medicine. At Dundee County Hospital, the mission is to provide. So the question that I have, why is Dundee County Hospital seeing a decrease in patients in all patient care areas? It's not just one aspect of our facility that we're seeing a decrease in patients, we're seeing them in all areas. So to understand why we would potentially be seeing a decrease in patients, we need to understand rural healthcare culture. In rural communities, people tend to be socially and politically conservative, conforming to traditional gender roles, and they're more actively involved in faith-based activities. Rural community members value self-reliance, personal hardiness, and productivity. To people in rural cultures and communities, health equals perseverance, functionality, and the ability to work. I will tell you that people in the rural community, if it's high season to be in the field or planting, they won't come in. It doesn't matter if they have an arm falling off. If they need to be out there, they don't come in. If it's something as simple that could be treated in the clinic, if our clinic hours don't facilitate their needs, they don't come in until it's bad. Members of rural community have higher health disparities compared to those in urban settings. Again, it's because of their definition of what health is. If they're able to work, then they're going to keep on working. The disparities increase the more remote the person lives. If they don't have that access to healthcare, the greater their health disparities are. Patients experience lower access to all aspects of healthcare and may substitute a primary care visit with a specialty visit or just not go at all. They don't understand that even though there's a specialty care doctor and they're a cardiologist, they don't understand that they aren't going to be able to treat um, the problem on their foot or the problem with their back. They know that they are more than their general doctor, but they don't understand that that doctor specializes in a heart. And they'll skip going to their regular doctor that needs to do their physical to see their overall health because they'll take the one day off from work and that'll be it. So, what are the barriers that cause rural health communities to not seek care or have access to health care? This may be not quite as different in all communities, but it is different in rural health communities just due to some of the economics, but health insurance coverage. Reasons: Affordable Health Care Act, changes in Medicaid funding. Certain states decided to do an expanded Medicaid funding, some chose not to. And the big difference is the poverty levels. There's higher poverty levels in rural areas. Workforce shortage. That refers more to the quality healthcare providers or just healthcare providers in general. In order for them to come to rural areas, you have to be able to pay them more. Unless you grew up in that area, people aren't going to want to just go and live in a rural area. Distance, transportation, you usually have to drive a farther distance to get to your provider, your general provider or your specialty provider. And some people just don't have a vehicle or a reliable vehicle or the time to get off of work. The social stigma and the privacy. People in a small town know when you change your curtains or you put out more trash or you have company come over. And so when you don't have that privacy in your own home, they don't think they're going to have that privacy when they go to the doctor. And if it's something they're going for that could be what they construe as embarrassing, they really don't want to be talked about uptown. And poor health literacy. People in a small community typically don't have as much education as those in a larger community. And so they are concerned about their ability to understand health information, instructions, and be able to communicate what they need to communicate with their health professionals. So, who does Dundee County Hospital provide services to? Well, Dundee County Hospital is located in a rural community in the southwest corner of Nebraska. We also provide care to patients in Kansas and Colorado as well. With a total population per the U.S. Census Bureau in 2016 estimated at 1,831. The age of people living in Dundee County: 4.2% under the age of 5, 19.7% under the age of 18, and a majority of our population, 25.8%, over the age of 65. The average household size for the residents of Dundee County is 2.18 persons. The average median home value, so the value of the homes, is $70,000, with 69% of the population being homeowners. The average household income, however, is $44,583. There has been a negative 7.4% change in employment between 2012 and 2016. So here's a look at the statistics for Dundee County Hospital. We have 9,500 outpatient visits, treatments per year, with 1,250 inpatient days per year, approximately. Our occupancy rate from October 2016 to March 2018 for an 18-month period was 11.61%. Looking at urban occupancy rates, and granted this isn't an exact time reference, is 63%. Other rural hospitals, 37%. So you can see that we are below the average occupancy rate, which is concerning. So what are some of our strengths and weaknesses at Dundee County Hospital? Things that we can say, this is what we have going for us that will work to bring patients in. These are some things that maybe we need to work on. So we have ideal nurse to patient ratios. We always, even if there's no one in the hospital, have 2 nurses on staff. We have committed staff for making successful hospital. We're engaged in providing quality patient care. We can tell when a patient is not themselves, and just by looking at them, we're that actively engaged. We do a lot of things for patients that don't have to do with healthcare when they're in our care. Some of the weaknesses: we lack trained healthcare professionals. We are constantly short on nurses and specialty providers. We lack the knowledge on how to increase our patient volume. We just don't understand the changes in the current healthcare climate. And we lack the finances to provide the educational opportunities to the employees that we have, and they're disgruntled about it. So my recommendations for our facility: we need to become more involved in the community. Our patients need to know that we are invested in the success of the community as we are in our hospital. We need to let them know that we're here for them as we want them to be for us. To let them know that in all aspects of their lives, we're there for them. Find out why our patient numbers have decreased. We performed a root cause analysis. Wasn't very in depth, but we performed one. We got a little bit of feedback. We didn't do much with it. We lacked follow through on it. And then we just set with the information that we had once we started to gather it. We need some aggressive recruitment of specialty providers. Our patients are telling us they're willing to travel, and we need to listen to them and bring those doctors to them for the ones that can't travel. Have a better system in place for follow-up care, for the patients that come in through the ER, for those patients that are seen in the clinic and we tell them we're going to get this lab work back and we'll call them, and then 2 weeks go by and we still haven't called them, and we have those patients that won't call us because we told them we would call them, and they're just sitting there waiting for us. We need a better system in place. We need to keep those patients that we have, and we're failing them by not following up. We need to advertise our swing beds as an option in our facility. And we need to do it in more than just social media. We cater to a population that is older, and most of our population does not use social media. So we need to advertise that after an acute stay, they have the option to come back to our facility if they had to have surgery at a larger facility. We need to teach, reteach, and then teach again to the staff what services our facility offers so that that revenue can remain in our facility. Even if a patient goes and sees a specialty provider outside of our facility, they need to know that they can come back and have their images done, the lab work done in our facility. We also need to know that healthcare is mobile and our patients will travel. It is our responsibility to find out what our community needs the most and provide that to them. Thank you for listening and have a great day.